PSA stands for prostate-specific antigen. It's a protein made by the prostate gland that can be measured with a simple blood test called a PSA test. But for some patients, it's also a source of confusion. That's because a high PSA doesn't always point to cancer. It can raise concern without giving a clear answer. Aging Untold expert Dr. Ray Rogers says an elevated PSA is really a sign that something else may be going on.
There's a lot of things that can raise the protein. So number one, if I get an elevated PSA, does that mean I have cancer? No, it means a smoke, go look, is there something else going on? So other things that can raise the PSA are inflammation, infection, even aging.
That uncertainty is part of why the test can be debated. A result may lead to more questions, more follow-up, and decisions about whether more testing is really needed. But Dr. Ray says the reason many doctors still use PSA testing is that it can sometimes flag a problem early, before symptoms ever show up.
It can be an early indicator. Maybe you don't have an enlarged prostate, maybe you don't have an infection, maybe you don't have inflammation. Maybe you do have an underlying cancer and now you had an early screen. You start looking at things and all that and go to the next step.
So the test really comes down to balance. It's not a yes or no test for cancer, but it can be a warning sign worth talking through with your doctor.